Good evening, everybody. Welcome to my presentation. As you've heard today, there's mistrust in the community in Louisville. There are disparities. And so hopefully through the field of nursing, I want to address these disparities through an education pipeline program. So my program is Exploring Perceptions of Contextual and Scholastic Factors Associated with Academic Success Among Students in a High School Nursing Magnet Program. What if we had a nursing workforce as diverse as the population they serve? So what if when you went into the hospital, you saw nurses that look like you? The purpose of my project is to identify cultural, social, and scholastic factors that are influential to successful admission in and graduation from a nursing program as perceived by a sample of underserved and minority students in a high school nursing pipeline program. The aims of my study would be identify expectations of a sample of high school students related to a profession in nursing, describe perceptions of students regarding the educational requirements for a career in nursing, identify facilitators for successful admission and retention in post-secondary nursing education, as well as identify barriers to successful admission and retention in a post-secondary nursing education. My research questions are: what scholastic and contextual factors influence selecting nursing as a career, as well as influence expectations of being a nurse, expectations of post-secondary nursing education, and influence admission and persistence in a post-secondary nursing education. So, as I said before, you've seen the disparities. Disparities in health status and healthcare quality are well documented among low-income, urban core, and minority populations. Healthy People 2020 defines health disparity as a particular type of health difference that is closely linked with social, economic, and/or environmental disadvantage. Many health policy, advocacy, and governmental organizations emphasize the need to address health disparities through diversity in health professions. Numerous studies in recent years have documented health care disparities among different racial, ethnic, and socioeconomic groups. Persons in families who are poor are about twice as likely as persons in high-income families to be unable to get or delayed in getting needed medical care, dental care, or prescription medicines. Minorities experience a lower quality of health services and are less likely to receive even routine medical procedures as compared to non-Hispanic white Americans, even when insurance status, income, age, and severity of condition have been controlled for. Health disparities are influenced to a significant degree by social determinants of health. The social determinants of health are neighborhood and built environment, health and health care, social and community context, education, and economic stability. The framework of social determinants of health is supported by the World Health Organization, which commissioned a report in 2008. Entitled Closing the Gap in a Generation, Health Equity Through Action on Social Determinants of Health. In addition, there are U.S. health initiatives such as National Partnership for Action to End Health Disparities and the National Prevention and Health Promotion Strategy that also support this framework. For the purposes of my project, I'll be focusing on the interplay between economic stability, education, and healthcare. Nationally, low-income adults experience higher rates of heart disease, diabetes, and stroke, as well as the children experience higher rates of asthma, heart conditions, hearing problems, digestive disorders, and elevated blood lead levels. In Louisville, approximately 13% of adults live in poverty and approximately 24% of children. So as you can see, income can have a major effect on health status. Higher educational attainment has been associated with positive health outcomes. People with higher levels of educational attainment are both more likely to be employed and more likely to earn a family-sustaining wage. People with higher levels of educational attainment are also more likely to combat stress through development of skills and establishment of social networks. Educated patients may be more able to understand their health needs as well as advocate for themselves and their families. There is a national need for individuals to become a part of the healthcare sector to address healthcare disparities that result from limited access to comprehensive, quality healthcare and primary care providers. There's a need for increased geographic availability for providers as well as culturally competent providers. If these barriers are not removed, it can lead to delays in receiving appropriate care, inability to get preventative services, financial burdens, as well as preventable hospitalizations. People with a usual source of care have better health outcomes, fewer disparities, and lower costs. So for the purpose of my project, this is the method I plan to use to address healthcare disparities. Programs are in place to increase diversity, but researchers haven't built up a base of evidence to prove their effectiveness to policy and other decision makers. There is needed research into these type of programs so that evidence-based decisions can be made about what parts of pipeline programs are most successful and cost-effective. Through my project, I hope to work with a high school nursing education pipeline program so that the admission, retention, and graduation of diverse students in post-secondary health sciences education can increase. Hopefully, this will lead to diversity in the nursing workforce, thus increasing the number of providers who can meet the specialized needs of minority and underserved patient populations. In Louisville, the community is losing potential college graduates due to students not being adequately prepared to go to college. Students have to spend more time and money to be successful because they have to complete remedial coursework before taking credits that actually count towards their degree. Education pipelines can combat the need for remedial coursework and better prepare students for post-secondary education. To start off, pipeline programs start early with students by targeting interventions that build college knowledge about academics and financing. They can also provide transitional support. For example, students in pipeline programs have increased opportunities to earn college credit and have assistance with transitioning from high school to college. Lastly, they can provide sustained support through exposing students to academic and social integration programs such as specialized learning communities. Registered nurses account for the largest body of healthcare workers. The nation is increasingly diverse, but the nursing profession remains predominantly white and female. The elimination of health disparities has been linked to the recruitment of underrepresented minority nurses. Nursing stakeholders support this recommendation to increase diversity to improve standards of practice, patient outcomes, and access to care. Experts have identified several strategies to increase diversity within nursing, including pipeline programs, improving primary and secondary education, and changing admission policies in health professional schools. Increasing diversity in the healthcare workforce is essential if we are to effectively address the problem of healthcare disparities in the United States. So, the design of my study, qualitative methods will be used to conduct focus groups with nursing students currently in a public high school pipeline program, and the high school administrators regarding perceived scholastic and contextual factors that promote student success, programmatic adherence, and college admission. Focus groups will be audio taped during 2 scheduled focus group sessions that will last for about half an hour. They will be conducted using a semi-structured interview guide developed for this study. Questions for the focus groups will be developed using findings from a prior study about programmatic and social factors that influence student outcomes in a long-running, successful, grant-funded pipeline program. Demographic data will be collected from focus group participants, which will include participant characteristics such as age, gender, grade level, and social factors. Audio tapes will be transcribed and verified for accuracy. Transcripts will then be reviewed and coded using content analysis to identify categories and themes resulting from participant responses. Findings from this study will inform the development of a nursing program intervention for low-income and minority high school students in the public school system. So I hope to develop an advisory board that will have representation from students, the high school administrators, and develop an intervention from this study. So next steps. I want to develop rapport with the target population, which is Central High School, if nobody knows that's the program I was targeting, and complete the programmatic and social factor study. This will give me the basis of what interview questions that we're going to use during the focus groups. And then I'll obtain IRB and develop a qualitative interview guide. I will pilot test and revise the interview guide with the advisory board that I mentioned earlier, and then I will conduct the focus groups and analyze the data, And then I plan to disseminate it through publication of journal, poster presentations, and definitely back to the community because they're an active member in the research I'll be doing, so I want to make sure they know what works. And then, as I stated before, this will lay the foundation for my dissertation, which will be the intervention actually being implemented due to limitations of me being a second year rising PhD nursing student. So, questions?
Study that you have, and you're identifying some of these resiliency factors and to investigate further with this population?
Okay, so I actually got to sit in the focus group that we did with the students, and so just from the responses I could gather that the things that they value and that has made them be successful in that pipeline program are things like, that visual encouragement from parents, being able to develop the skills of time management due to being involved in multiple things, and then the program has certain requirements for them to continue on in it. So those are the two things that stuck out to me when I was in the focus groups that helped them be resilient. Go ahead, Dr. Jones.
How are you developing a relationship with Central High School? Because it can be a challenge.
Yes, I've heard that. So I'm going the unconventional route. I'm actually going through a church member who works at Central, and then her niece is actually a student that's in the health magnet, so hopefully through that connection, because I've actually, this project is like my whole experience with nursing. So I've had students from Central actually come to our Black Student Nursing Association meetings and tell me there's this need, they want to do more than be a CNA. They want to be encouraged to go on and get advanced degrees, which is needed. I mean, this is just one way of addressing the need of diversity in nursing. But there also needs to be diversity in the leadership. There needs to be faculty members that represent these students as well. So hopefully by increasing the number of students, we can address those issues as well. Yes, Dr. Filipka.
Jade, this is a really good project because we definitely need this in nursing, so I applaud you for that. My question is, are you just going to be interviewing the high school students, or are you also going to interview minority nursing students actually in the program, or in the pre-licensed pre-nursing program? I'm just curious if you were going to go up the different steps to see what different, different levels of education, what their perceptions and what they see as the barriers of facility.
Right. For the purpose of this project, I'll be focusing just on the high school level. I would actually love to get down to even the middle school, because I feel like there's a lot of research out there about collegiate, so I really want to get to those younger groups because, by the time people get to college, it's too late for you to even be ready for a career in nursing. You have to have that strong science and math background. So hopefully by getting to these populations early on, we can address these barriers and overcome them so they can be successful in programs of nursing. Yes?
Jade, are you going to interview the counselors too?
Yes, high school administrators, they were included within there. Yes, ma'am.
Sometimes they steer them away.
Exactly. They can be a big barrier that has to be overcome, so educating them as well, and yeah, for sure.
One more question. Are you going to ask them about social media and the influence of that? Because I think that's a real detriment to our profession.
I definitely plan to address that, and doing my research, addressing the younger populations, when they have an experience with a nurse, it's usually getting a shot, so they have this negative connotation. So hopefully by addressing their perceptions, I can actually educate them on what actually is needed and what actually happens with nursing. Because even with our turnover rates, people get to the floor and they're like, this is not what I was expecting. So hopefully by educating these students early on, they can be better prepared and actually last within a career in nursing. Yes.
So playing off of the social media thing, you said that there is a Black Student Nursing organization within the nursing school. Do they have an Instagram that they kind of?
Yes, they do.
And does the program at Central, do they kind of refer them to hey, if you kind of just want to see what these people are doing, kind of referring them to that Instagram? Because I know I have a younger sister who's 14 and she's always on Instagram. So kind of.
Yeah. Well, they have a Facebook and they have an Instagram, and definitely whenever I come across a student who's interested in nursing, no matter, their demographics, I definitely refer them to that organization, because it's not just for Black students, it's to encourage everybody to be successful in nursing.
And is there a possibility that you could integrate that social media platform kind of into the long-term prospects of this project?
That would be a good idea, yeah. I'm a graduate student now, but I'm still actively involved in the undergraduate chapter, so I would definitely work with them and see what their board would approve. Yes.
So I'm curious about some of the unintended or intended consequences of parents. So you said parents were a huge factor in their resilience.
Mm-hmm.
And for those parents who may have the perception that you're really good in this healthcare profession and push them to then want to be a physician, as if nursing is not the pinnacle enough. And then two, for what might be, I've got a sister who has a lot of students who want to be nurses, and she mostly hears about it from her male students who are in middle school right now. And they are really interested in nursing, but there's some, even still, I guess, negative perception or stigma about young men going into nursing. And so do they lose that by the time they're in high school? Because this is middle school and they really want to be nurses, and she's just wanting to instill in them, like, that's a great profession, you know? So have you thought about either of those of like, oh, be a physician instead, or how young men are being pushed out because of the stigma around gender perception?
I think when people hear nursing, they always think about the tactile skills that we do, like the hands-on. They don't really know, like, there's so many different avenues within nursing. So just educating the students and knowing that you can get your doctorate in nursing, whether, you know, you're a DNP or a PhD student, and just knowing that it's not just being on the floor. So first, educating them on that. As far as, like, because I know I did a panel. I'm always doing panels with, like, middle school and high school students. And so just educating them, there's other avenues, and knowing, like, the different possibilities within nursing. And then as far as that male stigma, I actually had a student come up to me that was a male. He was afraid to ask me in front of his classmates about nursing. And it's like, oh, you know, like, he's like, you know, what's the difference between medicine and nursing? And it's just like, honestly, it just comes down to, for me, I think the medical model is not something that I prefer. I prefer our nursing model. I feel it's more holistic when giving patient care. So how do you explain that to middle school students, though, you know? But as far as changing the stigma, I think there needs to be better representation in imagery that they see, you know, framing that message, you know. Some things that I've saw is like, there was something like save a life, be a man, or something like there was to encourage men to be a nurse. I mean, John's here, he's a nurse, so I mean, what things helped you, you know, overcome that?
I come from a lineage of nurses, so for me it was, I just kind of always knew that talk at the dinner table and things of that nature that, you know, nurses tend to do was not, I just had to mature as a male until later in my life. I was like, you know, I think I could do some of those unpleasantries that come with it, which I was shy from, so, but that's just my personal experience, you know. The other guys that I know that are nurses, they always knew they were going to be a nurse, so I don't know how you get to that point from a young man to look into the field.
Mm-hmm. And
even now, I feel like as I'm working on my PhD, I'm learning so many other things. I just had no idea that this field was available.
Exactly.
So, you know, I'm 35 and I'm still like, wow, this is available in nursing. I had no idea. So I didn't know about that PhD until 3 years ago. You know,
Right.
like, oh wow, you can do that. So there's definitely a gap in knowledge, I would say, from a male perspective, but from my personal experience.
So when you think about your steering committee also being to really recruit or try to reach out to, I know you said you'll have youth on your steering committee, is that true? So will you also look at gender balances or making sure
for
that you
sure,
reach
yeah.
out to males?
I have African American male nurses that I know, and then through the School of Nursing, I know, you know, Caucasians as well, male nurses. So I'll make sure that I get that input from, you know, all sexes are represented. Or even I think people try to, the adrenaline junkies, you know, they try to use that to encourage male nurses too. So being ER, yeah.
I thought it was going to be a flight nurse.
Any more questions? Thank you guys for your time.